Alright, this is Dr. Rueda. Welcome to Precision Plastic Surgery again. Another question patients ask is, how's my consultation with you going to be? How is it different? How could it be better? And I would say that, first of all, we pride ourselves on dedicating good time to the patients. Here, we don't try to be a factory of seeing patients in and out or a factory of surgery of people coming in and out. Every patient has dedicated at least 30 minutes of face-to-face with me as the surgeon, at least, to discuss everything. And I think that's something that patients really value a lot. I take my time not only to meet you, not only to know you medically fully so we can make a good decision for you and your body, but I think it's also important to educate you. As a doctor, that's what we made our vow to, is to educate patients to make good medical decisions. And in the end, cosmetic surgery is a medical decision, although different than the traditional decisions that are made in medicine. But we emphasize a lot of video. We emphasize a lot of images, so when you're in the consultation room, it's not only about showing you before and afters, but we show you every option that's on the table for you, from the very most minimally invasive, from the most maximally invasive, and we explain to you the pluses and minuses of each. I'm very proud to say that I'm not a huge surgery pusher, even myself. I really care just about what you're gonna have in your result. And you're gonna see that when you come here, you're not gonna feel pressured. You're gonna know every option. If I personally don't think that you're a good candidate and it would put you in harm's ways or not give you a good result, or even questioning the result, I would just straight tell you that it's not a good idea. If I think that you would be a good candidate, I'll just explain that to you, but you would also not get pressured into having to do anything. Most cosmetic surgery takes people time. They have to see providers, they have to think about it, they have to research, and they have to do many things. And I think the last thing a patient wants is to come here and, number one, be pressured. Number two, just spending like 2 minutes seeing a doctor and then leaving and really not getting kind of an insight into what the surgery is going to be. I would say that another plus of consultations with me is I tend to be very realistic. So I don't try to minimize or sugarcoat your downtime or the bruising. So what you see is what you get here, and you get treated like if you're family. I actually tell patients that if I wouldn't do the same procedure on my mother or my father, then I wouldn't do it on you. It's as simple as that. I pride myself in just doing the right thing every time for you. In terms of the environment, I think it tends to be very relaxing. I'm very down to earth. You can talk to me about your desires, your wants, your needs, your fears. As picky as they may be, or if you're not sure, then you need some guidance, then I'm also happy to do that. But you wouldn't be afraid to speak to me or bring up concerns. If you have surgery done, I'm always welcome to hear everything that you have to say and just help you and guide you through the process. And I would say that that's why our consultations are different than every year. I think we pride ourselves on education, we pride ourselves on time, we pride ourselves on not pressuring you. And I'd say that people come here, they're very happy. So we would be happy to see you for a consultation if you're interested. Log in online to the link that you see at the bottom of the video, and we'd be happy to take a consultation for you for your dedicated time for your needs.